Hello everyone, I'm Dr. Adam London, Director of the Kent County Health Department. I hope everyone had a truly great and wonderful Easter weekend. Today is Monday, April the 13th, and I'm here to give you the daily COVID-19 update for Kent County. Statewide, we're now at 24,638 cases, as reported by the state yesterday, and unfortunately up to 1,487 deaths statewide. Here in Kent County, we're at 309 cases as of this morning, and 13 deaths. That's a total of an increase of about 40 cases over the weekend. So we're still seeing an increase day over day of about 20 people now, 20 diagnosed cases. So that number is largely staying flat, and so we're watching that very closely. We're getting a lot of questions about testing. Who's testing? How much testing? What can we do about testing? What materials are needed to conduct a basic diagnostic test? There are a number of things. You have to have the test kits. You have to have the packaging materials for those test kits. We have to have clinicians who can collect the specimen and process the test kit. And they have to have the proper protective equipment in order to safely have that encounter and collect that specimen. You have to have a laboratory that has the equipment and the capacity to receive and to analyze all of these test kits. And you have to have some infrastructure in place for an actual collection site, whether it's a drive-through or it's clinic space or it's going out into the community and collecting those tests. There are a number of things that are needed for testing, and at various points in time there have been various pinch points in that supply chain for those different items. Early on it was the test kits. More recently it's the laboratory capacity and it's the actual clinicians that are needed to collect those specimens. So we are all working to improve and increase the volume of testing that's available here locally. People are asking about that availability. Has it increased? And the answer there is a very resounding yes. A few weeks ago, only a couple hundred tests were being collected and tested every day. We're now seeing, because the hospital labs have done such an improvement to their laboratory capacity, that we're seeing about 2,200 tests being collected and analyzed every day here in Kent County. And we're also seeing private laboratories that are getting into that space as well, and that's helping a great deal, making even more availability for testing. Question: can anyone get tested? And the answer there is no. And the reason for that is that the healthcare providers need to prioritize where they're spending their time and who they're working with. Right now there are screening tools available online through telehealth. Also, the healthcare providers, if you call them, they will walk you through a screening process in order to identify if you have the symptoms that align with coronavirus. Also, if you have underlying health conditions or other reasons why you should be prioritized. It's important to know that, especially for people who are mildly ill, that testing does not change treatment. And so for those who are unlikely to be admitted into the hospital, testing isn't really going to change anything. If you have symptoms that are consistent with coronavirus, you should be isolating yourself as much as possible at home, trying to protect others that live in the house from the illness, if that's what you have. But the hospitals and other testers really want to make sure that we're prioritizing the testing supplies for those who need it the most, who are the most severely ill. We also make sure that we're providing protection for the healthcare workers. So opening testing to everyone right now would, especially people who are coughing or have mild fever, would expose those healthcare workers to an additional risk as they're working with all these mildly symptomatic people. We're getting questions about the health department. And are we testing? And the answer is yes, we are, but it's very limited and it's very targeted. And we're focusing our testing really on those environments where there are vulnerable populations living. Places like nursing homes and places like shelters where they don't have as much access to the healthcare of the hospital facilities, but we can help them with our nurses or with our supplies so they can collect those tests to serve their more vulnerable populations. We're also working to find ways that we can support first responders. And so we're trying to use our limited resources to really focus on those that are most vulnerable and those who are on the front lines of this epidemic. And we're keeping our eyes on new and emerging technologies. So we've heard a lot about the Abbott Rapid Test. That's something we're very interested in. We're hearing a lot about antibody tests and hopeful that we have access in the very near future to finger prick sort of antibody testing, similar to a diabetes blood sugar test or an HIV test. That could give us very quick information on whether or not someone has developed an immune response to a virus or not. Those are all things we're watching very carefully. It does concern me that we don't have great surveillance on what the overall prevalence of coronavirus is in the community. That's a concern that I have. One of the ways we're looking at trying to get more information is through a website that we've created in partnership with others. It's called Keep Michigan Healthy. That's keepmihealthy.org. And this is a totally voluntary website that if you'd like to help us, we'd certainly encourage that. You go into that website, you enter your information, and every day it'll ask you, do you have any of these symptoms? And these are all symptoms that are associated with COVID-19. And by doing this, hopefully we get enough people to participate so that we can begin to see, is the occurrence of these symptoms happening in a different way in the community? Are there surges in certain symptoms or reductions in the occurrence of certain symptoms happening in the community? Hopefully we have a sample of people willing to help us with that so that we can track those things and help to have one more tool in our toolbox to understand what's happening with the overall health of our community. So that's it for today. I'm Dr. Adam London with Kent County Health Department, encouraging you to stay positive, stay heroic, and please stay at home and stay safe. Thank you.